Sure, here's the lecture rewritten into points for easy memorization. Sinus Lifting Lecture by Dr. Moore Z. Problems in the posterior maxilla 1. Poor bone quality. 2. Decreased vertical height due to bone resorption. 3. Sinus pneumatization, increase in sinus volume. Sinus anatomy and function. Maxillary sinus, also known as the antrum of Highmore, located on both sides of the nose, connected to the middle meatus, found in the maxilla body, shaped like a pyramid, contains alveolar, zygomatic, and infraorbital recesses. Floor may have irregularities due to pneumatization. Sinus ostium connects the maxillary sinus to the nose, lined with respiratory mucosa and ciliated epithelium. Cilia help expel foreign objects by moving dust out in 20 to 30 minutes. Sinus lifting indications, not the first choice, should be considered when other options are exhausted. Alternatives include short implants, implants in front or behind the sinus, or basal implants. Treatment planning for sinus lifting. 1. Use CBCT to check for pathology and bone height. 2. Consider the ridge height deficiency cause. 3. Determine the necessity of vertical bone grafting. When to do sinus lifting. 1. If other solutions are not viable. 2. Requires at least 6 millimeter bone width. 3. Factors include crown implant ratio, opposing dentition, and parafunctional habits. Techniques and considerations. 1. External lateral approach, window made on the lateral ridge. 2. Internal approach, used if there is at least 5 millimeters of bone. 3. Simultaneous versus staged procedure, depends on bone quantity and primary stability. Flap design. 1. Staged procedure, semilunar incision. 2. Simultaneous procedure, trapezoidal incision with crestal incision, lateral window preparation. 1. Cut bone anatomically. 2. Protect the Schneiderian membrane. 3. Use piezosurgery for safe and efficient cutting. Postoperative care. 1. Avoid sneezing through the nose. 2. Use nasal drops to avoid sneezing. 3. Monitor for membrane rupture and repair if necessary. Internal sinus lifting. 1. Use if there is 5 millimeters or more bone height. 2. Techniques include drill system, piezosurgery tips, osteotomes, balloon technique, expanders, and dental bursts. Key points to remember. Sinus lifting should be a last resort. Ensure sinus is free from pathology before procedure. Choose appropriate technique based on bone height and patient factors. Post-operative care is crucial to prevent complications. This format should help you remember the key points of the lecture more easily.